All right, welcome back to the Problem With, and this is the Lies with Tell. And today's episode is something that is always something that it's brought up every election cycle. And I'm gonna start with this. Let me tell you something. That should piss you off. There's no other developed country on Earth, none, where getting sick could cost you your house, where one ambulance ride can cost you more than a round trip flight to Europe, where you can survive cancer but still died in debt. That only happens here, in the so called greatest country in the world. But when we say that America should have universal health care, like every other rich country, we're told it's too expensive, unrealistic, or my personal favorite, that's socialism. Nah, that's not socialism. That's just a lie. A lie that keeps people sick, scared, and bankrupt. And it's time we said it out loud. This episode is about the lie that the United States can't have universal health care. Because, a spoiler alert, we absolutely can. We just choose not to. And we're going to break it down. How the system works, who benefits, and why so many people, including people in the military, in Congress, and in the media, oppose something they already have for themselves. But let me start with a personal story, because this isn't just politics, it's personal. When I joined the United States Marine Corps, one of the biggest guarantees they made, besides a haircut every Friday, it was healthcare. TRICARE, dental, vision, emergency, preventative. It didn't matter if you got hurt in training, caught a cold, or needed surgery. You were covered. And not just you, your family as well. Spouse, kids, full coverage, no co-pays, no in-network anxiety, no surprise bills. And not once did I ever hear someone say, wait, isn't that socialism? Of course not, because we earned it, right? That's always the excuse. You serve, you get taken care of. But if you're not in the military, if you're a cashier or a school teacher or a gig worker or a stay-at-home mom, certainly now it's too much to ask for. Like, come on. And here's something I saw during my time in service that most civilians don't realize. A lot of Marines and a lot of service members stay in. Not for the medals, not for the deployments, not even for the pension. They stay in because of the guarantee of health care. I saw it all the time. People re-upping just to keep their kids covered, worry what would happen to their spouse if they got out, worry about affording insulin, worry that one accident in civilian life will send them into bankruptcy. So when people say, we can't afford universal health care, I just want to scream. Because the truth is, we already have it, we just ration it. We decide who's earned it and who hasn't. We give it to soldiers and senators, but deny it to the cashier who rings up your groceries or the bus driver who gets your kids to school. That's not about cost, that's about cruelty. And the numbers back it up. Over 27 million people in the United States have no health insurance at all. Another 40 million are underinsured, which means they have insurance but can't afford to actually use it. And every single year, over 500,000 Americans file for medical bankruptcy, so 500,000. Let me say that again. In the richest country in the world, 500,000 people go bankrupt every year just for getting sick. That's not a bug in the system. That is the system. But we're told this is the price of freedom, that we can't afford what countries like Canada, Germany, or the UK have. Really? Because we can afford trillion-dollar wars? We can afford corporate bailouts? We can afford to give Congress the very healthcare that denied the rest of us? Let me ask you this. How is it too expensive to cover insulin, but not too expensive to spend $886 billion on the Pentagon, going into $1 trillion? How is it too expensive to guarantee maternity care, but not too expensive to build detention centers at the border? How is it too expensive to give a kid with asthma an inhaler, but not too expensive to give ExxonMobil tax breaks. It's not about cost, it's about the values. And we've been lied to by the insurance companies, lied to by pharmaceutical lobby, lied by politicians who cash in on campaign donations while preaching personal responsibility, and lied to by people who have the nerve to say, I don't want to pay for someone else's health care, while happily cashing in on military, veteran, and government provided health care themselves. Let me say this as clear as I can. You already pay for other people's health care. You pay for ER visits, you pay for inflated premiums, you pay for tax breaks and subsidies that keep big pharma rich. So the real question isn't if we pay, it's who we pay and why we get in return. And right now, we're paying more and getting less. So this episode is going to walk you through all of that. We're going to break down what universal healthcare will actually cost and how it stacks up against your monthly premiums, your deductibles, your GoFundMe medical bills. We're going to show you how every other developed country makes it work, how they live longer, spend less, and treat people with dignity. And we're going to talk about the double standard, the hypocrisy of politicians, veterans, and government employees who already have coverage, but fight like hell to make sure you don't. Have you ever been on the fence? If you've been told it's too hard, too costly, or too complicated, just stick with me, because the truth is simple. We can afford it. Yes, we can. We just don't want to admit that the system we built, the one that lets hospitals sue patients while CEOs fly private, is broken by design. And until we call out the lie, we're going to keep living in it. So let's get into it.
Hey man, how's it going? Well, I was supposed to do surgery today, but apparently I'm out of network, so the patient had to cancel. Out of network? What does that mean? It just means insurance won't pay for the patient to come see me for their health care. Oh, I didn't know you worked for the insurance company. What? I'm in private practice. I don't work for the insurance company. You sure? Of course I'm sure. So when you see a patient, you send a bill to the insurance company, right? Yeah. And then the insurance company will pay you for your services. Yeah, that's right. Well, who decides how much you get paid? Well, you have to sign a contract with the insurance company. Well, what happens if you don't sign the contract? You don't get paid. Huh. So you do work, and the insurance company pays you for that work, and they pay you whatever amount they decide they want to pay you for the work you're doing. Yeah. I don't know. It kind of sounds like you're working for the insurance company.
If a patient comes in and they tell me they fell, and I write that in the chart, they fell at work, their health insurance, might deny that claim and say, what do you mean they fell at work? You said in your note. That means workers' compensation has to cover it, not us. The same thing will happen with a car accident. A patient will come to see me and they'll say my back hurts, but in the note they'll say, oh, I had a car accident 4 years ago. The insurance will deny it and say the auto insurance is supposed to pay for this. So they all kick the bucket on who's supposed to make the payment. You cannot imagine a more broken system, and the fact that it still somehow works is magical.
Let me ask you something. When was the last time you sat down and really looked at your insurance breakdown? Not just your monthly premiums, but the whole thing. The deductible, the co-pays, the out-of-pocket max, the prescriptions, the fine print, and the preferred providers. I mean, all of it. Most people don't even know what they're paying for, because health insurance in America, it's not healthcare. It's a gamble. And the house always wins. Let's break this down for real. According to the Kaiser Family Foundation, the average annual premium for a family health insurance plan in 2024 was $23,968. Yeah, you heard that. $23,000. That's more than most people pay in rent over an entire year. And remember, that's just the premium. That's just to have the plan. That doesn't include actually using it. Now, let's say you actually need care. Let's say your kid breaks their arms. Nothing extreme, just a little backyard trampoline mishap. A couple hours in the ER, sounds manageable, right? Not in this country. You're about to get billed for, here it goes, the ambulance ride if you dare to call one, if you really need it, the ER visit, the x-ray, the physician's consultation, the cast, the meds, the follow-up appointment, and wait for it. And this is a good one. A facility fee, because apparently you now pay rent just for being in the building. You'll pay the first $3,000, maybe $7,000 out of pocket, depending on your deductible. Then the insurance company steps in and says, oh, we're not covering that specific drug, or that specialist wasn't in network, or actually, we're only covering 60% of that procedure. And even then, you're still on the hook for co-pays and co-insurance, all for a kid's broken arm. Now let's talk numbers. If you have an employer-based coverage, the average deductible for individual plans in 2024 was $1,735. For families, it was over $4,500. If you're in the ACA marketplace and get a silver plan, your average deductible is $5,388. You're basically paying a used car down payment before your plan starts doing anything, and then come the out-of-pocket maximums. In 2024, those could reach up to $9,500 for individuals or almost $19,000 for families. That's the cap before your insurance covers 100% of it. Assuming, of course, you survive the paperwork and don't get hit with the denied claim nonsense. And I hear this all the time, and people say, well, I don't want to pay higher taxes for health care. Okay, but you think you're not already paying for health care? Because let's go even further. You're not just paying your premium, you're paying in lost wages when you avoid care because of cost, mental health stress worrying about bills, GoFundMe shame when something catastrophic happens. And let's be honest, your time, energy, and sanity fighting with insurance companies that exist to not pay claims. This is a scam. It's capitalism with a lab coat on. Like, private insurance companies spend around 8 to 12 cents of every dollar on administration. That's paperwork, billing, CEO salaries, legal teams, marketing, lobbyists, middlemen. You know what is it for? What is it for Medicare? About 2%. That's it. No commercials, no armies of denial departments. No, this plan isn't accepted here nonsense. In fact, according to the American College of Physicians, switching to a single payer system will save us over $600 billion a year just by cutting out all the middlemen and paperwork. That's not socialism. That's just math. It's just common sense. Now let's zoom out, bigger picture for a second. The United States spends more than $12,000 per person per year on healthcare. That's by far the most in the world. So here's how we stack up. Let's go with each country. In Germany, $7,300 per person. France, $6,400 per person. Canada, $6,800. United Kingdom, $5,500. And guess what? They all live longer than we do. They all have lower infant mortality. They all have universal coverage. And us, we rank 29th in life expectancy, 36th in infant mortality, and dead last among high-income nations for preventable deaths. We pay more and we die sooner. That's not just broken, that's predatory. Now here's where it gets darker. Because a study published in the American Journal of Public Health found that 66.5% of all personal bankruptcies in the United States are tied to medical bills. And here's the kicker. Most of those people had insurance when their financial crisis began. So much for just get covered, right? Imagine working your whole life, saving, doing the right thing, and then a diagnosis or an emergency wipes out everything. That doesn't happen in Canada or Germany or Japan or any wealthy country. Just name it. It only happens here. And part of the reason it keeps happening because we bought into this narrative of, well, if you just work harder, They had better insurance. But let's talk facts. More than 60% of uninsured in the United States are working adults. People with jobs, multiple jobs. The people who bag your groceries, care for your elderly parents, clean your office, cook your food, teach your kids, they're not uninsured because they're lazy. They're uninsured because they're priced out and exploited by a system that treats healthcare like a luxury item. And even people with good jobs are being crushed. Ask a public school teacher, ask a bus driver, ask a city worker whose employer plan still has $6,000 deductible and a $200 ER copay. Ask any parent trying to make it in a city where rent keeps rising and healthcare premiums are like a second mortgage. And here's the wild part. We don't even like this system. Only 38% of Americans say they're satisfied with their private insurance experience. I bet you that's the politicians themselves. Meanwhile, support for government-funded healthcare is sky high. In 2023, a Gallup poll showed that 70% of Americans support some form of publicly funded universal healthcare. And 58% say they will support Medicare for all, even if it meant higher taxes because they know they save money overall. So let's just be honest. The idea that private insurance is better than public healthcare, that's a big fat lie. It's a lie pushed by billion-dollar companies that don't treat you like a person. They treat you like a risk profile. It's a lie that keeps people trapped in jobs they hate because they're afraid to lose coverage. It's a lie that convinced working people to fight against their own interests because someone told them universal healthcare will mean waiting in line behind immigrants and freeloaders. But the truth is, we already wait. We already ration. We already lose. And we pay more than anyone else in the world to do it. We pay so much money to wait in line. So here's what we're going to do in the rest of this episode. We're going to take the look of what universal healthcare actually looks like in countries like Germany, Japan, and United Kingdom, and even more. We're going to dig into the real numbers, what it will cost you in taxes versus what you're already shelling out. And we're going to expose the people in Congress and the military who already have universal coverage and still tell the rest of us it's impossible. But before we go there, I just want to leave you with this. If this system is so great, why are we the only country still doing it this way? Because stick around, we're just getting started.
More than half of working-age Americans are struggling to pay for health care, even if they have insurance. That's according to a recent survey which found rising costs have caused nearly 40% of Americans to skip necessary treatments and medications. 4 in 10 Americans with employer-sponsored plans or Medicaid have difficulty paying for health care. 3 in 4 people without insurance say they can't afford to pay for their care. CBS News Money Watch reporter Megan Cerullo is here in Studio 57 to talk about her reporting here. So, Megan, just break this down for our audience. I mean, it's no surprise that in this country people struggle to pay for health care. I think what many people who have good health care coverage will say is, wow, there are people that are insured that can't pay for health care.
Right, we're talking about Americans with insurance,
Yep.
and while it is better to have health insurance than to not, they're saying that it's inadequate, and as a result, they're avoiding care, they're delaying seeking treatment for medical conditions, and as a result, they're getting sicker and poorer, and they're putting off treatment because there are costs like co-pays, co-insurance, deductibles that they simply can't afford. So it's
All right, so we established that the United States spends the most and gets the least when it comes to healthcare. So naturally, the next question is, well, what do other countries do differently? Because here in the United States, we love to say we are the greatest country in the world. But when it comes to healthcare, let's be real, we are the exception, and not in a good way. Here's the cold hard facts. The United States is the only wealthy, industrialized nation that doesn't guarantee healthcare as our right. We're not talking about small experimental countries. We're talking about Germany, France, the United Kingdom, Canada, Japan, Australia, Sweden, modern nations with strong economies and functioning democracies. All of them guarantee healthcare. All of them cover everybody, and none of them send you into medical bankruptcy for a hospital visit. Now, here's the thing that gets twisted. They don't all use the same system. Some are single payers, some use hybrid, some allow private plans, some don't. But what matters is the outcome, universal coverage. Everyone in, no one left behind. So let's walk through a few examples. Let's go with the United Kingdom. They use the NHS, National Health Service. It's fully funded through general taxes, free at the point of service, no bills for doctor visits, no co-pays, no deductibles. Need surgery? Cover. Need chemo? Cover it. Need mental health services? Cover. Is it perfect? No. There are wait times, especially for here's the key, non-urgent care. But no one is choosing between chemo and bankruptcy. And you know what the British think of their NHS? They defend it like it's the crown jewels because it works. Now let's go with Canada. They use a single payer system. Every province runs its own system, but funding comes from federal taxes. You go to the doctor, show your health card, and that's it. No bills. Yes, you might wait a few weeks for elective surgery. But no one dies from a tooth infection because they couldn't afford antibiotics. And don't believe the myth that Canadians are flooding across the border to use our system. That's propaganda. Canadians they pity us and our system. In fact, 95% of Canadians support their system, even when they have complaints. Their life expectancy is 81 years, ours 76, and they spend half of what we do per person. Now let's keep going. Germany, universal multi-payer. Yes, they use private insurance, but it's heavily regulated and non-profit. You pay into a sickness fund based on your income. Employers match it. Doctors and hospitals are private, but price control. You can choose your doctor, you can switch funds, but no one is uninsured. The entire country is covered. No bankruptcies, no network games, no surprise bills. Now, if you think it's only Europe, let's go with Asia. Japan, regulated multi-payer. Workers and employers pay into the government-run plans. The government sets a fixed price for every medical procedure nationwide. You want an MRI? It's the same price anywhere you go. Doctor visits cost around $10 to $30. Prescriptions, affordable. And the quality, they have the highest life expectancy in the world, over 84 years. And again, they spend about half of what we do per person. So again, it's not about the model. Some countries do single payer, some do universal coverage with regulated private insurance, some like Australia even offer public and private plans side by side. But none of them tie healthcare to employment. They don't let people die because they couldn't afford insulin. They don't require GoFundMe just to survive cancer. They don't force families to decide between groceries and asthma medication. They treat healthcare as a public good, not a for-profit industry. So why do we treat it like that? Because let's talk about it. Because the reason isn't technical. It's not logistical. It's not about freedom or efficiency. It's three things. Number one, profit. Because of course, the United States healthcare system is a $4.5 trillion industry. Insurance companies, pharmaceutical giants, private hospital chains, they are all getting rich while we are getting crushed. Just to put it in perspective, in 2023, United Health Group CEO Andrew Whitty made over $20 million in total compensation. Then let's go with the CEO of Cigna, over $21 million. Meanwhile, your premiums just went up again. Pharma companies mark up drugs by 10 times or more compared to what they charge in other countries. And they are legally allowed to do it because Congress won't negotiate drug prices thanks to lobbying. The next part, misinformation. Americans have been lied to for decades. We've been told And here's the lies they say. Universal healthcare means government-run doctors. You lose your freedom. You will have to wait months to see a doctor. You'll pay more in taxes. What we are not told, you already pay more in premiums and deductibles and mental stress. We've been conditioned to fear what every other rich country already does successfully. And here's the best one. Number 3, racism and classism. Yeah, we're going there because we have to. Universal programs in the United States tend to lose support the second people of color or low-income folks are seen as beneficiaries. That's not an opinion, that's history. Let's go with Social Security. Originally excluded farm and domestic workers, jobs held mostly by Black Americans. Then we go with Medicaid expansion has been blocked in red states because it will disproportionately help Black and brown people. It's not that the system will fail. It's not that it's that the system might work and benefit everyone equally. And that, in America, still feels like a threat to people in power. Now, before we move on, I want to address one of the most common arguments I hear. Well, yeah, but that's nice, but those countries are smaller. They don't have 330 million people. We just can't afford it. Okay, let's break that apart for all you dumb people who still believe in this. First of all, scale doesn't make it harder. It makes it more efficient. When you spread risk and cost across more people per person, costs go down. Also, the United States already runs two of the biggest public healthcare systems in the world. Medicare serves over 65 million Americans. Medicaid serves over 83 million. Combined, that's almost half of the United States population already using government-funded healthcare. So don't tell me we're too big. We're already doing it. We're just doing it halfway and calling it a day. We have the money. We have the infrastructure. We just lack the political will because too many people are getting rich of your pain. So let's recap this segment. Because every other wealthy nation guarantees healthcare. They do it with different models, but they all get better results. They live longer, pay less, and don't fear getting sick. We have the tools to do the same. We just haven't because of greed, lies, and fear. So what we're going to do in the next segment, we're going to tackle the question everybody asks. But how would we pay for it? We'll compare universal healthcare tax models to what you're already paying in premium and bills. And we'll ask, will you rather pay taxes or pay for your own bankruptcy? Because either way, you're paying. The difference is who profits from it. Stick with me.
One big thing you should know about the US healthcare system. It's barely a system at all. It's a patchwork, a bunch of different systems crammed together. That's why it's so expensive and why it can be such a pain to use. We haven't really decided what we want to prioritize, and that's part of the reason we don't have universal healthcare like so many other countries do. So why doesn't the US have universal healthcare? There have been lots of calls for it, dating back to Theodore Roosevelt, who proposed national health insurance in 1912. But a national system of government-run health insurance never happened. Instead, employers started offering health insurance during World War II as a benefit to attract workers, since everyone's wages were frozen. That's how we got the employer-based health insurance system we have today. Instead of creating one program to cover everyone else, the US decided to add to it piece by piece. Medicare for seniors, Medicaid for low-income people, CHIP for kids, and each one of those programs is a patchwork within itself. There's the Affordable Care Act, another complex marketplace for people who don't have another source of health coverage. The catch is, that still leaves about 28 million people uninsured, including low-income adults and non-citizens. Many of those who haven't signed up say it's because they can't afford the coverage. By contrast, Switzerland has required everyone to buy health insurance since 1996. Canada has had national health care since 1968. Britain has had it since 1948. Germany requires everyone to be insured by a sickness fund, a system that started in 1883. The bottom line, unlike other countries, the US has never reached a consensus on whether healthcare is a right or whether universal healthcare should be a goal. Unless that happens, the US isn't going to have the kind of healthcare safety net that other countries have.
All right, let's talk about The big, scary word that gets thrown around anytime we talk about universal health care. Taxes. Ooh. Because the second someone hears Medicare for all or single payer, the first reaction isn't, oh wow, that could actually save lives. That could help me. No. It's, how are we going to pay for that? Do you want the government taking more of your money? I don't want to pay for someone else's health care. Alright, cool. Well, let's be grown-ups and talk about this. Let's stop pretending that we aren't already paying, and paying big, for a broken system that doesn't even cover everyone. So first, let's look at what we're spending right now. In 2024, the average American household spent around $22,000 per year on healthcare. And that includes employer contribution, which still comes out of your compensation. Don't be fooled. Premiums, out-of-pocket costs, deductibles, co-pays, prescriptions, and yeah, the surprise bills. That's more than the average rent in most states. That's more than most people spend on transportation, education, or food. And you don't even get full coverage with that. You still end up arguing with insurance over pre-approvals and denied claims. And it doesn't count the indirect costs. For example, missed work because you couldn't afford to see a doctor. Skipped medication that led to an ER visit. Untreated illnesses that got worse and more expensive. So when someone says, I don't want to pay for someone else's healthcare, you already are. You're just doing it in the dumbest, most expensive way possible. So how would a universal healthcare actually work? Let's look at a few real-world models that have been studied and priced out by economists. Not opinion, not vibes, is data. Okay, model 1, income-based payroll tax, a flat 7.5%, 7.5%. Okay, this comes from the Rand Corporation. The workers pay 7.5% of their income. Employers match that contribution. No premiums, no deductibles, no co-pays, no surprise bills. Let's say you make $50,000 a year. That's $3,750 a year in healthcare taxes. Now, compare that to the $6,600 plus the average American pays just in premiums and out-of-pocket costs. That's nearly $3,000 in savings every single year. Let's go with model number 2, tier, progressive tax system. This has come from the Urban Institute. If you make under $30,000, you pay almost nothing. Middle-class folks pay 4 to 7%. Higher earners over $500,000 pay up to 15 to 20%. Employers still pay in, but less than they do for private insurance. And get this, 95% of households will save money or break even. Only the top 5% will pay more, and they can afford it. They had universal healthcare for their stock portfolios for decades. Okay, let's go with model number 3, the VAT or payroll tax hybrid. This is based on systems in France, Japan, and the UK. This is a small value added tax, VAT, so VAT on goods and services, combined with modest payroll deductions. So yes, your groceries might cost a little more, but in exchange, no premiums, no deductibles, no hospital bills. You're not afraid to call an ambulance because it might cost you $3,000. You're not sitting on a tooth infection because your dental plan doesn't kick in until next year. And here's the wildest part. Even the Mercator Center, the libertarian think tank funded by the Koch brothers, ran the numbers and still concluded that Medicare for all will save the United States $2 trillion over 10 years. Let me say that again. A Koch-funded think tank accidentally proved universal healthcare works. Oh, shocking. So when someone says, it's too expensive, you can hit them with this. Then why did the Koch brothers own think tank admit it saves money? The people they probably follow. Let's make this real. Let's go with a case study. A 30-year-old worker. Right now, you're paying $400 per month in premiums. That equals $4,800 per year. That's a $2,000 deductible as well, $500 in prescription costs. Total, $7,300 plus. Under universal model, 7.5% of your tax on 50K income, that equals $3,700 per year. No copays, no deductibles, no anxiety about switching jobs and losing coverage. That's nearly $3,500 in savings every year. That's a news card, that's rent, that's finally going to the dentist. That's peace of mind. Now let's talk about businesses. Right now, the average employer pays about $16,000 per employee per year for family coverage. And every year, those costs go up faster than wages. Small businesses are the ones getting screwed the worst. They can't afford to compete with corporate healthcare packages. But under the Medicare for All, their contribution drops, their paperwork disappears, their employees stop getting buried in medical debt. That's more money for hiring, more money for wages, and less stress for everyone. And that's why growing numbers of small business coalitions actually support universal health care. Because they're tired of getting shaken down by Blue Cross and Aetna, whatever the name is out of the other company. But this isn't just about the spreadsheets and tax models. It's about the access. When healthcare is free at the point of service, people go to the doctor sooner. Chronic illness gets caught early. Preventable debts go away. Preventable debts go way down. I misspoke there. Mental health care becomes an option, not a luxury. And people aren't rationing insulin or skipping cancer screenings. You don't need to comparison shop for your health. You don't need to beg an insurance company to cover basic tests. You don't need to live in fear of losing your job and losing your care. And look, I'm not pretending this will all be perfect. There still will be flaws. There will be debates. There might be wait times for non-emergency procedures. But let me ask you, would you rather wait a couple of weeks for a knee replacement or wait forever because you can't afford that $20,000 bill? So here's the real truth. We are already paying for a healthcare system. We are just not getting one. And until we stop pretending this is someone else's issue, we're going to keep hemorrhaging money and lives. In the next segment, we're digging into the hypocrisy at the core of this debate. The people who scream the loudest about how we can't afford healthcare for all, they already have it. Congress, veterans, federal employees, military families. We'll walk through TRICARE, the VA, Congressional insurance, and what it means when people with government-funded healthcare are telling you it's impossible. Stick with me.
I lived in the UK for 5 years, during which time my family and myself all had healthcare on the NHS. Nobody had to check our insurance before they could even see us. We simply made our appointment, we went to the doctor, we received our care. That was it. In the US, being sick meant that we had crippling medical debt. We were considering filing bankruptcy. We had no consumer debt, only medical debt. In the UK, that was not a problem. I have myalgic encephalomyelitis chronic fatigue syndrome, or ME/CFS for short, which means the more I do, the worse I feel. Because of ME/CFS, I'm currently unable to work, and I'm only able to leave my home a couple of times a month. I'm primarily housebound and bedbound. We only moved back to the United States because the Affordable Care Act came into effect. Yet we're still here 4 years later with the same situation. We have maxed out our credit cards because of medical expenses. We have to decide whether to go to the doctor or ration my medications or buy food. And this isn't hyperbole, this is something that just happened. This was a discussion that we had this morning. I support Medicare for all because healthcare is a human right. I think that people get scared, and I understand that fear.
If Canada can provide healthcare to all people, the UK can provide healthcare to all people, every major country on earth can provide healthcare to all people. I don't think it's that scary.
I want to tell them that they don't need to be afraid, that my experience with universal healthcare has just been overwhelmingly positive, and there was not one aspect of my life that it did not make.
You ever hear a politician say something like, "We don't want government-run healthcare in this country"? Or they also say, "Americans should have the freedom to choose their healthcare." And all you want to do is scream back like, bro, what healthcare plan do you have? I can't have freedom of who is my doctor. It depends on the insurance that is in network. Because here's the truth, that somehow never gets said on the Sunday shows. The very people who scream the loudest about we can't afford universal healthcare are the same exact people who already get it. Let me run down it for you. Politicians, active duty military, veterans, federal employees, and all of their families. They are all covered. They are all publicly funded, and they all get comprehensive care without GoFundMe pages. This isn't a conspiracy, it's public record. And it's the biggest open-air hypocrisy in American politics. Let's start at the top, with the members of Congress. Every single United States senator and representative and the president gets access to taxpayer-subsidized health insurance through the Federal Employees Health Benefits, FEHB program. They don't pay market rates. They don't argue with Cigna about their deductible. They pick from dozens of plans, and taxpayers, you and me, cover 72 to 75% of their premiums. According to the Congressional Research Service, that comes out to about $14,000 per member per year. And yet, how many of them vote against expanded Medicaid? How many of them say universal healthcare is too expensive? Make it make sense. And don't let them dodge it by saying, well, I pay taxes too. Sure, so do teachers and warehouse workers and janitors, and also the undocumented immigrants. They pay more taxes than they do, but they don't get a platinum plan courtesy of the federal government. So if you're voting to keep them uninsured while you cash in on public coverage, yeah, that's hypocrisy, point blank. And this is why they keep running in Congress and Senate, because they know they have the coverage. Now let's talk about the military, and this could be very controversial. And everybody's gonna say, "Oh, you hate the troops." No. I don't hate the troops. I'm a veteran. Come on. I love my brothers and sisters. I'm just pointing out the flaw systems in this country. Because here it is. When I was in the Marine Corps, my healthcare was called TRICARE. You probably have heard this. Let me be honest. I'm so grateful for it. TRICARE cover everything. Routine care, emergency visits, mental health, dental, eye exams, even prescriptions. And you know how much I paid? Basically nothing. No $500 ER visits, no out-of-network drama. No. No, we don't cover that phone calls. It was full spectrum coverage, funded by taxpayers, and I didn't have to stress about calling a doctor. But here's what eats me. I was single throughout my military career, but I served next to Marines with wives and kids who depended on that health care. Some of them re-enlisted just to keep the coverage. So, and not because they loved deploying, not because they wanted to keep taking orders, but because it was the only way they could guarantee medical care for their family. That's not a choice, that's coercion. And look, I'm proud of my service, but let's get one thing straight. You shouldn't have to sign a contract to die for your country just to be treated like a human being by a doctor. Healthcare shouldn't be a reward you unlock for putting your body on the line. It should be the bare minimum of a civilized society. Now let's go with the next group, veterans, the VA system. Because let's talk about what happens after you serve, the VA. The Department of Veterans Affairs is fully taxpayer funded. In 2024, the VA's healthcare budget was around $124 billion, and it included general medical care, surgery, mental health treatment, physical therapy, specialized care for combat injuries, substance abuse recovery, and full pharmacy access. That's universal healthcare, just limited to those who were in uniform. And let me ask you, have you ever heard a politician call the VA socialist? Did Fox News ever run a segment asking, why are veterans getting free healthcare on your dime? No. Because when it's for the military, it's called patriotism. When it's for working class people, suddenly it's government handouts. You guys see the game here yet? Let's go with the federal employees. Let's not forget, 2.1 million civilian federal workers also get the same FEHB plans that Congress uses. In fact, the federal government is the largest employer-based healthcare provider in the entire country. More than 8 million people, workers, retirees, and their families are on publicly subsidized healthcare. So how is that not government-run healthcare? Because it is. They just don't want it called that because they get to use it. You don't. Let me break it down. Again, Congress, federal employees' healthcare benefits, 70 to 75% taxpayer funded. Active military, TRICARE, 100% taxpayer funded. Veterans, VA, 100% taxpayer funded. Federal employees, same thing, FEHB, 70 to 75% taxpayer funded. Now compare that to the minimum wage worker in Texas making $15,000 a year. They don't get Medicaid because the state refused to expand it. They don't get employer coverage because their job is part-time. They don't qualify for subsidies because of a policy loophole. So what do? They don't go to the doctor. They get sick and they end up in the ER with a bill they'll never be able to pay. Meanwhile, the congressman who voted against expanding coverage gets treated at Walter Reed with no copay. Let's talk about the language as well, because this country loves to change the words depending on who is getting the help. When it's rich people, we call it a benefit. When it's poor people, it's a handout. When it's Congress, it's employer coverage. When it's laid off parent in Detroit, it's dependency. When it's TRICARE, it's earn. When it's Medicaid, it's welfare. But here's the deal. Healthcare is healthcare. And whether you're in uniform, behind a cash register, teaching third grade, or cleaning hotel bathrooms, you deserve it. You deserve healthcare because you are a human being. And I know someone's going to say, but Luis, those benefits are earned. These people serve. And look, I get it. I said I wore the uniform. I lived that life. I'm grateful for what I had access to. I was so damn healthy at that time. But let me be absolutely clear. Human dignity should not be a reward for military service. What about the kid born with a chronic illness? Or the single mom fighting breast cancer? The construction worker who threw out his back? Or the teenager with diabetes working a fast food job just to survive? They don't earn any care? Like, we're going to say they don't deserve the life pain, like to live pain free because they weren't useful enough to the country? That is not morality. That's market logic. And market logic doesn't belong in the ICU. And I've seen what real compassionate care looks like. I've had it. I watch friends depend on it. And I serve beside Marines who stay in the Corps just to protect their family's health. And I come home and I watch civilians struggle and die because they couldn't afford basic checkups. This is not about merit. It's about access. It's about humanity. It's about fairness. Because the truth is, the people who most oppose to universal healthcare are the ones who already have it. They just don't want you to have it because we're a selfish country. Because then they're not the exception anymore. They're not special. They're just part of the system that finally works for everyone. And that apparently is scarier than your medical bankruptcy. Because now we're going to go to our final segment. We're going to take this all the way home. Because we talked about what we pay, what other countries do, how we could fund it, and who already has it. But we haven't talked about why it still hasn't happened. The answer is not money. It's always power. Because if we had universal healthcare, real guaranteed care, workers will be harder to exploit. Politicians can use fear to divide us. And corporations will lose one of their favorite weapons, your dependence. We're going to talk about that. Stay with me.
Thank you for calling Big Health Insurance Company Incorporated. How can I help you today? Hi, I'm just trying to figure out why you guys didn't pay for my hospital bill. Oh, well, it appears you have not met your deductible yet. But I pay $300 a month for health insurance. Oh, that's your insurance premium. Well, then what do I get for my premium? You get the opportunity to pay your deductible. Okay, so once I pay my deductible, then you'll pay for all my health care? Yes, sir. Except for your coinsurance. Oh, yeah, I have to pay that every time I go see the doctor. Oh, no, that's your copay. I'm talking about your coinsurance. Well, what's coinsurance? That's the percentage of every medical bill that you have to pay. Even after I've met my deductible? Yes, sir. And even though I pay my premiums every month? Yes, sir. Is there ever a point when the health insurance I pay for pays for my health care? Well, you do have an out-of-pocket maximum, which is the most money you'd have to pay in a calendar year. Oh, well, that's good. You just have to make sure all the hospitals you go to and the doctors you see are in-network. What? Why? Because any out-of-network charges don't apply to your insurance plan. Well, how do I know what's in-network and what's out-of-network? Oh, we try to make that information as difficult to find as possible. Well, that's just great. Is there anything else I can help you with? Oh, yeah, I noticed you added a $50 service charge on my bill. What is that for? Oh, that's a charge for you calling us today. Wait, how did you know I would call you? Well, we anticipate none of this making sense to people and bill you accordingly.
All right, we've talked numbers, we've talked systems, we exposed the hypocrisy, and we painted the picture of what's possible. But now we got to be honest about the real reason we still don't have universal health care in the United States. Because it's not the math, it's not the logistics, it's not wait times or doctors or hospitals. It's always one thing: power. And it's always been about control. So let's rewind. Back in the 1940s, yes, 80 years ago, President Harry Truman proposed a national health insurance program. He wasn't some radical. He was a centrist, a Cold War Democrat, a president who dropped the atomic bomb. And what happened? The American Medical Association, the AMA, backed by insurance companies, launched a multi-million-dollar smear campaign. They call it socialized medicine. They said it was the first step towards communism. They warned that letting the government help sick people will somehow destroy freedom. And the sad part is, it worked. That playbook, it hasn't changed in 8 decades. Today you can turn on any cable news network and hear the same talking points. Government takeover, loss of freedom, higher taxes. But behind all that noise is one simple truth. They're scared of losing control. Because when your healthcare is tied to your job, your boss owns your body. When you need insurance to keep your kids alive, you're not going to walk out and strike for higher pay. When one wrong move could cost you your coverage, you're easier to control. That's not freedom. That's dependency by design. That's what America wants. And it's not a flaw, it's a feature. Because then let's go. In 2023, the healthcare industry spent over $713 million on lobbying. Imagine how much healthcare we could have with that money. And that's more than oil, more than big tech, more than defense contractors, more than any other industry in the United States. They deploy over 2,700 lobbyists. That's 5 lobbyists for every member of Congress. Why? Because their profit margins depends on your misery. If people got care without copays, deductibles, or denials, United Health stock will collapse. If insulin costs what it does in Canada, Eli Lilly couldn't just buy its 5th jet. If you could see the doctor without fearing the bill, you wouldn't need Aetna or Cigna or the entire fake marketplace we call choice. This system was built to fail you and succeed for them. And this is the other part. The divide, distract, and destroy hope. And here's when it gets even dirtier. When the money isn't enough, they use division. They pit us against each other. They say, why should immigrants get health care? Why should someone who didn't serve in the military get free treatment? Why should I pay for someone else's bad choices? They frame it like justice is a zero-sum game. And it works every time, every freaking time. Poor people are told to resent even poorer people. White workers are told black and brown families are taken from the system. Rural voters are told their cities are wasteful. Urban voters are told rural folks are ignorant. It's the oldest trick in the book. They don't want you to look up. They want you to look sideways or look down mainly. And so you fight your neighbor instead of the corporations billing you $5,000 for an emergency room visit. And when we fight each other, they win. every time. Remember what I said in the intro? The house wins all the time. And what do we do about it? Like, look, we could stop here. We could sit in the anger, the frustration, and the grief. But I didn't build this show to give you despair. I built it because I believe we can change this. So here's what we do. If we do tangible, concrete, and real. Let's go step by step. Step 1, state-level universal healthcare pilots. Places like California, New York, and Washington have drafted proposals. If even one of them succeeds, it becomes a blueprint. Support those campaigns. Join coalitions. Donate. Knock doors. Step 2, ballot initiatives. In states like Oregon, Massachusetts, and Colorado, ballot measures have expanded Medicaid and capped drug cost. Even failed measures build pressure and visibility. They matter. 3, call out the hypocrisy. Don't let politicians get away with saying, well, we can't afford healthcare, while they enjoy the fully taxpayer-funded plans. Ask them, will you give up TRICARE? Will you give up your congressional plans? Make them look their privilege in the face. Now let's do the next step. Step 4, fight for reform on the way to revolution. While we fight for Medicare for all, we can cap drug prices, ban surprise billings, regulate private hospitals, expand Medicaid in holdout states, push for nonprofit hospitals to stop suing patients over bills. Next, step 5, change the conversation. Stop asking, how will we pay for it? And start asking, how are we paying for this broken system now? How many more GoFundMes do we need? How many people have to die waiting for permission from Blue Cross? We don't have to wait for some perfect system. We just need to stop settling for one that's killing us. And this is my story, and this is yours as well. I've been on both sides of this. As a Marine, I had TRICARE. It was simple, it was comprehensive, it worked. I didn't have to choose between a checkup and a paycheck. I didn't have to worry about whether a doctor was in network, and I never had to open a bill in fear. When I left the service, that changed overnight. Suddenly I had deductibles. Suddenly I was undercover. That's the real term, by the way. Suddenly I was paying to stay alive. I've seen people I love skip medicine, delay treatment, work through illness, get sicker, and sometimes not make it. My family, my mom, she decided to skip her. She was diagnosed with breast cancer. She didn't go to a doctor for many years because she couldn't afford it. And guess what? That cancer spread, and she died of breast cancer and bone cancer. So this is personal too. Here's the thing: it's not because she was not lazy. She was the hardest worker ever, and it's not because she wasn't neither patriotic enough. Like, that lady knew more about America than all the whole white America knows in their pinky. She knew more about America than everybody else. But because the system doesn't believe everyone deserves to live, that's what it all comes down to. Who do we believe is worth saving? Because right now the answer is only if you're profitable. And that's the lie. And it ends when we stop accepting it. And here's what my final ask. Here's what I want you to do before this week is over. Because I want you to do 3 things. 1, share this episode with someone who still believes the myth. And 2, ask your rep directly where they stand. No vague access talk. I need real answers. 3, get involved locally. Join a Medicaid expansion campaign, a union, a healthcare justice group. And when someone says, we can't afford universal healthcare, tell them this: we already are. We're just letting the wrong people get rich while the rest of us suffer. It doesn't have to be this way. It never did. And if enough of us say so, we can change this.
Now in our investigation into medical price roulette, which finds Americans are paying a wide range of costs for the same medical procedures. We teamed up with journalists at Clear Health Costs and asked you, our viewers, to tell us what you paid for tests and procedures. And we've heard from hundreds of you. Thank you. And tonight, Anna Warner has a story to which we can all relate.
I mean, I thought that I was dying. It was really scary. And I did, yes.
Molly McKenna was in agonizing pain when her fiancé rushed her to this Austin, Texas Baylor Scott and White clinic last January.
The doctor came in and said, your ovary is a big hemorrhaging mess right now. We have to take that out.
One of her ovaries was twisting inward, cutting off the blood supply.
It just got to the point where I could barely even breathe.
She was transferred by ambulance to a larger Baylor Scott and White hospital for surgery. At each stop, staff took her private insurance card. Yet a few weeks later, she was told much of her treatment was out of network.
My heart just dropped.
The amount she owed? More than $40,000.
I mean, what is that like for you? I remember crying. I was very upset.
McKenna is just one of over 600 people we've heard from in our Medical Price Roulette series that highlights the financial gamble consumers face with medical care.
I would be paying less out of pocket if I just had no insurance at all.
Insurance broker Laura Everest, who sold McKenna her policy, says paying cash would have been cheaper.
Nobody told her that she was out of network. Nobody gave her the option to pay cash or self-pay.
So you basically think that they're gouging?
Absolutely.
Because Everest says McKenna's insurance already paid over $6,000 for the surgery. McKenna negotiated a few bills down, but Baylor Scott and White still wants $27,000 more.
Because there is no guideline. There is no transparency. They can charge whatever they want.
I'm not a human to them. I'm a dollar sign.
Baylor Scott and White told us this afternoon its facility charges are lower than other local acute care hospitals, but said this case shows what they call an opportunity for improvement. They now say they'll be contacting Molly McKenna to help solve this, Nora.
Well, Anna, the question that everybody has is what do you do then in an emergency situation?
Right. So a few things. Find out which hospitals are in your network that are close to you. Find that out now before the emergency.
Way ahead of time.
Yeah. Way ahead of time. If it's not a life-threatening emergency, consider a walk-in or urgent care clinic, which should be cheaper. And when the bill arrives, try to negotiate.
Let me end with this episode. There's a phrase we all know, even if we rarely stop to ask what it really means. That phrase is life, liberty, and the pursuit of happiness. It's printed in textbooks, echoed in courtrooms, recited in speeches. We treat it like gospel. It sounds like a promise, what America should be, the American dream. And that no matter who you are, no matter where you're from, this country exists to protect your right to exist, your right to be free, and your right to live fully. But in 2025 America, I have to ask, what does life mean in a country where people die because they can't afford insulin? What does liberty mean when your job owns your health coverage and quitting means risking your kids' asthma medicine or your own life as well? What does happiness mean when getting cancer means going bankrupt? We throw these words around like they're sacred, but too often they're just branding, marketing. A lie told so often it starts to feel like truth. Because in this country, the only pursuit that's fully protected is profit. And I'll take you a little history lesson because I love this. In the 1800s, American towns, especially in rural areas, actually provided free healthcare. You didn't need a premium or a network or a biometric ID. You just needed help. And that help came in the form of county doctors, paid by taxes, available to anyone. You had a baby, they came. You caught pneumonia, they came. You were poor, didn't matter. Because back then, healthcare was about community, not commerce. But that changed. By the early 20th century, hospitals got privatized. Insurance companies saw a gold mine. And politicians, well, they learned how useful it was to turn care into a battlefield. And here we are, in the richest country in the world. People with stage 4 cancer are doing car washes to pay for chemo. Veterans are dying on VA waiting lists while politicians promise flag pins. Teachers are skipping meds so they can pay rent. And the most common way to raise money for surgery is a GoFundMe. That's not policy failure, guys. That's violence dressed in a necktie. Right now, as in this year, the same politicians who tell you they are pro-life are trying to raise the Medicare eligibility age to 70, working to privatize the VA, blocking Medicaid expansion in over a dozen states, and pushing to cut benefits while calling it fiscal responsibility. Let me be blunt. You don't get to call yourself pro-life if you're cutting people off from the very care that keeps them alive. You don't get to wave a flag and say you love liberty when people are chained to a job they hate just for health coverage. And you as sure as hell don't get to talk about the pursuit of happiness while Americans are choosing between groceries and medication. They have to choose between food and keeping their kids alive. These people, many of them, have government-funded healthcare themselves. They get TRICARE, VA care, federal employer get benefits. They fly on private planes, see private doctors, get concierge access, and they turn around and said, sorry, the rest of us are just need to budget better. Sorry, man, that's just it's not hypocritical. It's class war. And I've seen the damage firsthand. Like I mentioned, my mom died of cancer. Also my dad. Could have been prevented, but they didn't go to a doctor because they couldn't afford it. They had insurance, guys. And the insurance company didn't cover their treatment. And I've also seen this recently. I've stood in classrooms where students miss school because they don't have access to a doctor. I watch parents choose between antibiotics and rent. I've seen working families, really good people, lose everything because someone got cancer or had a heart attack or got into a car crash. Not because they were irresponsible, but because this country decided that profit was more important than people. So when these politicians say life, liberty, and the pursuit of happiness, here's what I think it should mean. Life should mean getting to see a doctor before your condition becomes fatal. Liberty should mean not having to stay in a soul-crushing job because it's the only thing keeping your kid alive. And happiness should mean holding your partner's hand in a hospital room without wondering how many months of wages that visit will cost you. But capitalism doesn't believe in that version. Capitalism asks, do you qualify? What's your deductible? How much can you squeeze out of your pain before you die? And we're all being trained to call that normal, because it's not. We're not dealing with a broken system. We're dealing with a rigged one. Here's the thing about systems. They only last as long as people accept them. And more of us aren't accepting it anymore. We're done with the gaslighting. We're done with being told that we're asking for too much. We're done being told this is just how it is. We know better. Because in every other wealthy nation, this isn't a dream. It's a reality. Other wealthy nations pity us because they take care of their people. We don't. And the difference? It's not money. It's will. So here's my ask. Not as a host, not as a veteran, not as a political commentator. As a person who has lived in this system, if you're tired, I see you. If you're scared of getting sick, I hear you. If you're angry, I'm with you. But don't stop at anger. Use it. I want you to share this episode with someone who still believes the lie. Call your representatives. Demand better. Show up at a town hall. Ask hard questions. Support workers, the nurses, the teachers, the organizers who are fighting for all of us. Join something. A campaign, union, movement. Be part of the change. Because here's the truth. Healthcare is not a luxury. Healthcare is not a reward. Healthcare is a right. And we're done asking politely. And that's all I'm gonna say, guys. I'm Luis. This is The Problem With, The Lies We Tell. And today, we tell you the truth.